I am a registered nurse with the VNA of Manchester in southern New Hampshire. I am on the IV team. I also do maternal child health nursing, and I fit in some home care along with that when I can. I do Sunday through Thursday, so I'm off every Friday and Saturday, and that works out well for me and my family.
As an LNA, I help patients in a home care setting. I start my day helping patients get ready. I get them up in the morning, I help them bathe, I prepare meals, and I feed patients. I can perform range of motion or just help them do the things that they can't do on their own.
I'm a physical therapist for the Manchester VNA. We go house to house. We work with patients after surgeries. We see chronic conditions, congestive heart failure, COPD. We work in these patients' houses because they're doing well enough. They don't need to be in a nursing home, but they would have a hard time getting to an outpatient physical therapist or any outpatient office.
If they were not able, for whatever reason, to have home care, many of these people end up having to stay either in the hospital or a long-term care facility. Many patients don't want to do that. They want to be home with their families. So having us come to them gets them home sooner, helps them to get better sooner, allows them to be with their family, their pets, sleep in their own bed.
You go to see one patient, it's like one-on-one. It's just you and the patient. There are no distractions. So I get to spend more quality time with them. We're catering to the patient, and that's really nice.
Seeing the improvement in our patients is a big motivating factor, I think, for a lot of us. Seeing them get out of their house easier or accessing their home easier, it makes it worthwhile going to work. So when I started out as a student, I didn't even know home care was a thing for PTs. I thought I would work with a sports team or I would work in an outpatient office, and I did home care as one of my clinical rotations, and I immediately knew that's where I wanted to end up. I liked the freedom of it, I liked the variety of it. I do appreciate my coworkers too. I think we have a phenomenal team at the VNA. They really do try to go above and beyond for patients. Really work with salt to the earth type people.
It's just such a great place to work. I just tell anybody who is thinking about home care to come on over. We support students in our area. We have student nurses that come through and follow with us. We would welcome any of them after graduation because they've been excellent. We really do mentor and do a good job with orientation for our new nurses.
They've always been very supportive, and with our classes that we take and our online education. Anytime I have any questions, my manager gets right back to me within 20 minutes. It's a great open line of communication between the two of us.
That's probably the number one best thing in home care is the communication. You are communicating with other members of the team. You really feel involved in the care because you're getting the perspective from other disciplines. And if you have issues, you're just calling into your manager or your director, and somebody's there to support you.
You know, taking care of a patient at home, they're more comfortable, and that I come in there and at least it's one smile that they have that day. I'm very proud of what I do. When I put my head down on the pillow at night, I did something really positive. People really appreciate it.
I think home care can be a long, rewarding career, for sure. You don't necessarily have to move up to a manager or director. You can refine your craft, you can get better at what you do, you can expand your skills to work with more people.
If you enjoy working on your own and making decisions about your day, such as who you're going to see, the order that you're going to see them, where you're going to travel to, then home care is for you. So I just say come join us because we'd love to have you.